Hi, my name is Alexi. I'm a student nurse and I will be demonstrating how to start an IV on a peripheral infusion. The first thing to do is identify the 6 rights of medication, which is the right patient, the right time, dose, medication, route, and documentation. The first thing that I will do is I will verify that my patient has orders, and it looks like we have patient IV needed for an IV of 0.9% normal saline of 1,000 milliliters over 6 hours. So after doing the math, we will get 28 drops per minute. So our patient is a middle-aged female, so we're going to be using a 20-gauge IV catheter. She is also allergic to penicillin and latex, so when we gather our supplies, we'll make sure that they are latex-free and that none of the medication is a variant of penicillin. So I've got my IV bag. I'm just checking for any discoloration, particulates, integrity. I will also get my 20-gauge needle and catheter, my IV tubing, flush, gauze, saline lock, Tegaderm, my alcohol swabs, and some tape for securing my IV in place. All right, now let's go see the patient. Hello, Ivy. My name is Alexi. I am your student nurse for today. Can you please verify your name and date of birth?
IV needed, and my date of birth is 12/25/1984.
All right, and are you allergic to anything?
I'm allergic to latex and penicillin.
All right, so we've got some latex-free products here. We're gonna be starting an IV on you today. So looks like your admission documents show that you're a little bit dehydrated and you have a bit of an infection going on. So we're gonna try and get you treated for that. So what we're gonna do is we're gonna start an IV on you and get that rolling. So I'm just gonna get set up here. I'm gonna have you relax your arm. Okay. And on my IV bag, I'm gonna have patient name, the date, as well as my initials. I have the rate of infusion as well as the start time, which is 8 o'clock, and since it's over 6 hours, it'll be finished at 2 or 1400 hours. I have my IV tubing. To which I will label today's date and time. And I will go ahead and clamp before I spike the bag. Okay. And now we are flushing the line. And we're also going to make sure that our chamber has fluid. And now we're also checking for any bubbles. And that looks good. Trying to recap that for now. All right, next I'm going to get my supplies ready here. I'm going to tell my patient to leave their arm in a dependent place here. I'm going to palpate for a vein. Okay, and I found one that I like. We'll take the tourniquet off and I'll get the rest of my supplies ready. We'll also check for a pulse to make sure that there is blood flow and perfusion to this arm. So we'll first do some hand hygiene. Okay, I will now flush the saline lock. Get my gauze ready. Once we put the Tegaderm on, we'll also label it with the date, our initials, and what gauge the catheter is. So now I'm going to replace the tourniquet and proceed. Okay. Go ahead and pump your hand a few times. I'm going to let the septic dry. We're going to make sure that your bevel is up. Alright. And then you also pull taut down. I got flashback. So now we'll advance the catheter, pulling the needle out, pull the tourniquet, and also press down on the vein. And I will grab my saline lock and flush 1 to 2. And then we'll go ahead and remove. The next thing we need to do is go ahead and apply, oh dear. We will clean first because this is a bit of a messy process. And now with our dated and timed, we will go ahead and stick that over. And then the next thing we need to do is we need to secure it in place. We'll go ahead and put a little piece of gauze underneath. And tape it down. And then the next thing we will do is connect. There we go. set our drops. All right. And then the next thing we will do is tape our IV in place. That way our patient is least likely to pull it out on accident. We got room to give. All right. And then we will also dispose our sharps and clean up. And then we'll also document this in the MAR about the IV line that we have started and the size gauge of catheter into our notes. And we will also explain to the patient that they need to try and keep their arm straight, especially if it's over a joint. We'll come back in an hour and we'll assess for any phlebitis or infiltration of the IV. And we'll just ensure that the IV rate is still continuing. So we'll check for any kinks in the line, and that's kind of about it. Thank you.